Hello, everyone. Okay, what time is it? We are at 2:03 here. We will get started like right now. All right. I can't see how many people we're at. Let me introduce myself. I am Shalise Lee. I am the Indiana Nutrition Incentive Network facilitator today, and I will be for the future. I have been here since April 15th to be exact, and I'm the nutrition incentive manager for the Division of Nutrition and Physical Activity. Welcome, everyone. Thank you for joining today. Um, we're in just a moment. What I'm going to ask you to do is into the chat, if you would put in your name, your organization, and your role, that'll help us to network, know who's here. And also, if you would put in a number one for if you want to be added to the double up um, pillar for today's conversation. We're going to have breakout sessions. And so if you can enter a number one for double up or a number two for produce prescription, that would be great. It help us to divide you into the groups that will best serve you for the conversation, best serve us for the conversation as well. So name, organization, role, and then a number one for double up and a number two if you are a produce prescription practitioner or implementer. I will give you a few moments to do that and then we will move on. All right. Michelle, are you still seeing my presentation screen?
No, I'm actually seeing myself.
Oh, maybe that's because of me.
There we go.
Not too, okay, great. I still think it's me here. All right, great. Thank you all for entering your information into the chat. We will be able to set up our breakouts based on you selecting a number one or number two for those purposes. So, our agenda today is packed with information about the Nutrition Incentive Network, what we have coming up in Double Up, what's going on in produce prescription, and then again, we'll have some discussion about double up produce prescription. And then our third pillar is food equity. So, welcome. And let's see, what we're going to do is initially, I'm going to start outline some ground rules for our incentive network and our community of practice meetings that we'll be having a short time after this meeting. We'll kick off some community of practice meetings for our pillars. Then Michelle will present on our state of food is medicine work. I'll then go into our priorities of what food is medicine is, what our team has been up to with the Indiana Nutrition Incentive Network. We'd appreciate your feedback and we welcome suggestions as we go through this meeting for topics and priorities that you would like to see come from us um, and what you'd like to get out of our network. So feel free to drop in the chat topics and suggestions as we go through this meeting. All right. If you're a double up practitioner, like a market manager, um, or you implement SNAP in any way, you'll be joining the double up pillar with us later on. If you implement produce prescription, if you are a Produce RX grantee, or your healthcare systems partner, then you'll want to join Michelle in that prescription breakout room. After we've had those discussions, we'll reconvene and then have a discussion on our current state of food is equity in our state and the ways that we can network together and then support each other in making Indiana's food system more equitable.
Shalice, let me know when you want me to pull up the poll questions too.
Okay. Okay. I think that I will go over the mission here and then we can start that. So just so that we cover it, our mission here at IDOH is to promote, protect, and improve the health and safety of all Hoosiers. And our vision is for every Hoosier to reach optimal health regardless of where they live, work, or play. Um, We'll go ahead and do the survey now. We have a survey. We're going to ask some questions about your work in the food system. Um, that should come up shortly here. Or you putting a link in the chat, Michelle?
Yep. And
Okay.
I can go ahead and
So
share my screen here too.
okay, we'll put the link in the chat, and then you guys can. So once you click on the link, as participants are responding, we will get those responses and we'll be able to proceed forward with the survey. So if you could just enter your responses, that would be great.
And for those who just joined, if you haven't already, go ahead and put your name and organization, and then number 1, if you want to be part of the double up breakout session, or number 2, if you want to be part of the Produce RX breakout session in the chat. And also, this is being recorded, so we'll be able to send some notes and recording out. Okay, well, it's great to see new people joined that initially hadn't, so that's great. All right, I'm going to go, just for the sake of time, going to go on to the next question here. Just wanted to gauge who everybody was representing. Great. Go on to the, go on to the next one here. And then it's the last question. A lot of produce prescription programs here. All right. I can't wait to learn too of the other healthy food access projects and stuff that everybody's doing. All right. Well, I will stop sharing, Shalise, and
Okay.
to avoid there.
All
Thank you,
right.
everybody.
All right. Let's see. We're going to go here. All right. Thank you, everyone, for taking time to complete that survey. That will help us as we create content for ININ meetings moving forward and help us learn who you are and what you do for our food system. So thanks again. All right. So what I want to do, we'll go into, this is today's agenda. I think I already went over it, but we're going to go into the ground rules. I will share those here. All right. So we're going to be a network of people connecting, sharing, coming together, going over challenges that we're facing, sharing successes. And so I want to put at the forefront just how we can do that and how we can do that most effectively. Um, a lot of those, a lot of these topics that we talk about are going to be sensitive topics. And so I want to just take a moment to kind of honor what we'll be talking about. They're really simple guidelines that are designed to help us create space where everyone can contribute meaningfully, excuse me, and also feel valued. They're going to help us support our conversations and make sure we get the most out of our time together. I'll go over them pretty quickly here. So, with building community, the Indiana Nutrition Incentive Network is a space for practitioners to come together to share ideas, experiences, challenges, and successes. We have an opportunity to be effective in our respective roles if we're sharing what we know and learning what we don't know. We want to embrace asset based language. We want to look for the opportunity in every challenge and every lesson. Hopefully, we can work together to overcome the challenges that we see um, that we're facing in our food system. Excuse me. We also want to honor boundaries and foster growth. So, take care of yourself in these meetings and conversations. It's okay to pause and take a break if necessary. Also, we're all coming from different experiences and levels in this work, so ask the questions you don't know. I know I sure will, so I may have questions for you, and we ask that you be patient. If you come to find out that you don't know something, we're all here to learn. We'll move on to the next one, which is ensure confidentiality. Our meetings are here for practitioners and food as medicine interventions. When we're discussing our challenges and opportunities, we ask that sensitive information discussed remain sensitive and that everyone respect those boundaries. All right. So next we want to go over some of the team updates that we've had here in um, the DNPA. Michelle started here in, was it March or April, Michelle? I could be completely off, but maybe it's earlier this spring. Michelle started as food as medicine director. And then in April, I came on as the nutrition incentive manager. Most recently, we've had two new positions added. Corey Chatterton, who most of you know, as the Community Food Systems Manager. And last week or the week before, we just added another member to our team, Dwayne Brown, who will be serving as our breastfeeding strategy coordinator. So we are happy to have um, almost a full house here. All right. So what we'll do now is Michelle is going to present a little about food as medicine, so that everyone has an idea of where we're coming from with food as medicine, what we are planning for food as medicine, interventions, and produce prescription. I will stop sharing, Michelle. Is that okay?
Sounds great.
All right.
Hello, everybody. Yes, I started in January 23rd. So almost 7 months. And it's been great. I've learned so much. For those who I do not know, I actually came from the Marion County Public Health Department. I was there for about 16 years doing nutrition incentive programs for the last 7 of those years. Um, and so it's nice to see some familiar faces. And one of the first questions around if you had joined the Indiana Nutrition Incentive Network previously, we actually kicked it off in 2019, focusing on Double Up. But in the last few years, watching just how this work has evolved, we're super excited to have Shalise here to really revitalize it and have a space for implementers and practitioners and supporters to be here. Okay, I will go ahead and share my screen. I'm not going to go through all of these slides. Give me one second here. All right, I think you guys are seeing, hold on 1 minute. You're seeing the presentation one. There we go. All right, so Shalise already went over our mission and vision. So food as medicine, what do we mean? It's still actually a work in progress. Even at a national level, I'm really learning a lot of, what's being done, some national recommendations and best practices at the same time, really trying to identify what everybody's doing across the state. Double Up Indiana, thanks to the St. Joseph Community Health Foundation, they have been able to really scale that for us through some CDC funding that we had here at IDOH in our division. And we'll be, taking what they have done and really building that out even more. And then produce prescription programs, we have about 9 currently being funded through CDC dollars here at IDOH with pilot programs and implementing those produce prescription programs. So I'm still learning all of that as well, like landscape scanning of the state, along at the same time with policies and all sorts of things. But when we think of food as medicine, and I'll share these slides as well to everybody because I'm going to go through them fairly quickly. But just looking at, what is the problem? We know poor diet leads to death, mortality in the United States, costing lots of money. What is the solutions around food as medicine? There are interventions that are actually, research is starting to show the how effective they are, especially within a management and prevention of chronic diseases. And then the definition I have provided here, this is actually provided through Tufts.
While we do.
Oh, there we go. I'm gonna go ahead. And and really these definitions are what are defined through 3 organizations nationally. You have the Rockefeller Foundation, you have Tufts, and then you also have the American Heart Association that's heavily involved in this food as medicine work. And it's really around encompassing nutrition services and then embedding it within healthcare practice. And so those 2 cores that they talk about is the provision of food that supports health and also a nexus for the healthcare systems. But at the same time, there are many other partners at the table to really fit the mold around a particular approach that you're doing. So let's say produce prescription, for example. Go on to the next slide here. Many of you have maybe seen this before. So this is when we talk about approaches, this is actual interventions around food as medicine. The three areas that we will be focusing on here in Indiana is produce prescription programs, government nutrition security programs, and also population health policies and programs. And then, of course, nutrition education is embedded within all of these, but we will not be focusing on medically tailored foods or medically tailored meals within the scope of our work at this point. There's already organizations that are doing that currently. Now, this is just, it's very busy, but this is my mind and vision being put on a PowerPoint slide. I've gotten lots of questions, and I was hopeful that I could really start working on something to kind of provide a vision to everybody on what we mean when we talk about food as medicine and how it is a bigger umbrella when we're looking at the framework and the infrastructure that we're trying to build. And so one, you have approaches. So this is the actual pyramid when you're looking at produce prescription programs, when you're looking at policies around SNAP and WIC programs, and then also the very bottom tier of our Double Up Food Bucks program and any other food access program that is providing more healthier food access to communities. And this is where the Indiana Nutrition Incentive Network will support. And embedded within all those approaches, then you have food equity and you also have nutrition education. And I think what's important is that organizations maybe start to recognize what's their role and responsibility within a food as medicine intervention. You know, maybe it's if you're a healthcare system, then you're the one recruiting, referring, you're building out your EMR system to screen for food and nutrition insecurity. And you're also able to eventually, you know, bill for it. So those are the types of policies which I'll touch on here in a minute. And then the other two pillars is around policy system and environment work. So working with our Medicaid office and, you know, really exploring what may be a policy that we can get passed for these types of interventions to actually be approved to be covered, whether that's through demonstration waivers, whether that's through coding and billing. And on top of all of that, we have this component of technology that has to be worked on. Having roadmaps and EMRs and moving towards e-incentives or EBT integration for Double Up Indiana, making referrals. So as you can see, it's a very complex process when we think of it. And then the last pillar is education. And this is actually in a national alignment when it's recommended that we get more doctors and physicians getting more nutrition education. And so we might not be doing that, but who are our partners and stakeholders to the table that could really help spearhead that and, you know, come up with some solutions around, you know, meeting that objective. But like I said, this is a work in progress. This is something where we hope that as we build out a coalition eventually for food as medicine, that everybody at the table will help us kind of mold what this framework will look like throughout our state and who will be helping with what and doing what. I'm very excited. I think it's already had lots of conversations with people and I'm excited to continue to do that. And then the last few slides I just wanted to share is just, you know, what are some of the policy system environment. Currently, we have a consultant that is going to be providing us with some policy considerations. We hope to hire a food and health policy manager in the next few months or hopefully by the end of the year. And this person will work alongside the consultant through and then will be the one to really implement some of these considerations. So still more to come on that. We just got started having conversations, but we're excited on where that's going to be moving forward. And then I'm not going to go through these, but these are the different policy considerations that are provided at a national level that we can definitely explore. So you have a few with Medicaid, some Medicare, and then also there's a new one called Coding for Food. This is a work group that I will be a part of, and it's actually a way to determine codings for various food as medicine interventions. So there'll be some standardizations around coding these programs so that they could hopefully eventually in the future be reimbursed. And then programmatic support, for produce prescription, we want to be able to continue to leverage funding where we can for programs throughout the state. We also want to be able to provide TA support where needed, as well as evaluation support, really streamlining our evaluation, um, helping with any innovation around technology, helping our healthcare systems be able to utilize their EMRs more efficiently when it comes to these types of interventions. And so that's where we're trying to place ourselves somewhere in that scope of work in regards to produce prescription and providing that assistance. And here's just kind of a nice visual of a produce prescription program, and kind of to my point earlier, as you think about your organization, where do you fit in these various roles of a produce RX program? A lot of times your healthcare systems are the ones that are identifying the patients, doing the referrals, but then where's your food coming from? Who's your food source? Is it on a card for a grocery store? Is it a food bank? Is it a food delivery? Is it a local farmer or grower? So those are the things that you would typically figure out during that beginning process. Who's doing the nutrition education component of it? And then, of course, there's the data collection and evaluation, which is one of the things that we really want to support here at IDOH. And then lastly, programmatic support, which Shalise will be the main person in contact in regards to Double Up Indiana here in our division. And again, we want to utilize this platform to provide TA support, communication efforts. How do we boost awareness around Double Up across our state? We did apply for a GusNIP grant, and for those who are not familiar, it's a Gus Schumacher Nutrition Incentive Program grant that's through the USDA, and it is a dollar for dollar federal to non-federal match. We did about a 1.2 million request federal, so if we match that, we'll have about 2.4. We hope to hear maybe something at the end of this month, crossing our fingers. But that'll be a grant for 3 years that will go specific towards Double Up and really scaling and growing that program. And then also evaluation, we'll have a data manager who will be supporting the evaluation around that work here. And that is it, Shalise. The rest of these slides, I'll go ahead. We'll share these slides, but there's some videos of how Double Up works. Also, I plugged in a couple of showcase videos that were done in Marion County around FreshBox that I think are really great, that you guys can go ahead and review on your own once we send these slides out. And then this is my contact information, and I'll put it in the chat, but feel free to reach out anytime. Or if you just want to have a conversation and around the work that you're doing, feel free to reach out.
Thank you, Michelle. Sorry about that. Couldn't find my mute button. Appreciate your sharing. A lot of the information that you shared is a lot of the information that we're going to continue to talk about here. All right, so she gave a few updates about our GusNIP application, and here in the beginning of my slide is pretty much the same information. What we will be doing, well, what I will be leading the charge on is the transition of Double Up Indiana from St. Joseph Community Health Foundation to IDOH. And so what that looks like is three regional partners will be implementing Double Up under IDOH. And so those partners have been identified as the Northwest Indiana Food Council, Northeast Local Food Network, and then Urban Seeds, which is south in Evansville. We plan to have 3 regional coordinators on site for each of those partners, and they will be then assisting local farmers markets, local retail spaces through uh, double up implementation, right? So there are some of you are farmers market managers that are operating double up, and you'll be able, they'll be your first line of contact. Right now, that's me as we go through this transition. And so I just spoke with the Nashville Farmers Market market manager on Friday. We had a great conversation about things to come for Double Up. And so things that we're talking about is like what supports can we offer for markets during this transition. So we'll be offering technical support to market managers regarding SNAP. We'll be offering support with funding for like tokens and any type of challenges that markets are experiencing. We'll be here to work through those with you. And so I'm excited to meet and work with these markets. We'll have an opportunity later on to talk about some of the challenges and successes that markets are having across the state. But one additional thing that we're going to be working on is expanding the reach of Double Up in the state of Indiana. And so there are counties and rural areas in the state that don't have access to Double Up, and that's affecting their residents. And so I'll be working with current SNAP implementers and seeking out new opportunities to implement SNAP around the state so that we can fill those gaps. With the support of me and Michelle, and we're calling ourselves the Food is Medicine team here at IDOH, our regional partners will support current firms. And just to give a definition on firms, those are those organizations, farmers markets, retail spaces that are implementing Double Up. So we'll be supporting you in your Double Up ventures and onboarding new organizations. Right. I think Michelle may have spoke a little about the transition, or not the transition, but the expansion of the Food is Medicine team. And that's, we're going to, with the addition of the GusNIP funding, we'll be adding a state double up coordinator, which will be supporting those three regional housed coordinators. And then they'll be able to, and I'll be assisting them with technical assistance as well. So we plan to have a robust team to be able to support this expansion effort, this transition from St. Joe into IDOH. We are also planning on hiring the policy manager, which will work with WIC and other state agencies like FFSA in order to discuss plans to improve e-incentives. SNAP and Fresh Bucks here in Marion County are not working together right now, but there's interest from a lot of SNAP implementers to have those talk more. And so we will be discussing that in the future and how we can get that as a process to assist those double up implementers. All right. Okay. We're going to go over just the timeline of how ININ came to be. ININ was created actually by Michelle in her time at the Marion County Health Department in 2020 as the result of a need for uniformity amongst double up marketing. So when St. Joe was awarded the GusNIP, they took on branding for Double Up, and provided grant dollars to farmers markets and retail spaces that were interested in offering Double Up. And so now that's where we have the Double Up implementer farmers markets and retail spaces that are operating currently from those funds. And then in 2021, 2020, 2021, Wholesome Wave conducted some stakeholder interviews, and the decision was made to make the transition um, from Marion County Health Department to IDOH for ININ after determining the need um, to expand the reach of SNAP, and then to fold in the existing food justice and food equity work that the state had interest in doing. So this brings us to the current status of the ININ network, relaunching into a 3-pillar model and being intentional about creating spaces for practitioners to network and implementers to center equity in our food system. All right. So we'll talk a little bit about our vision for ININ. The overarching vision is for the network to support people and their programs to be as effective as possible. We aim to build an infrastructure to support statewide Double Up programs, and food as medicine interventions, including produce prescription. The visions that we have for ININ will absolutely evolve based on feedback from you and other key stakeholders. So we will have open conversation, open dialogue to find out what you're needing. These are really starting points here that we can build a conversation around as we determine what the needs are and where opportunities for growth and sustainability can fit. Our goal is to understand where we can support growth for expansion of nutrition incentive programs like Fresh Bucks, and expanding Double Up into other areas, rural areas, and also food as medicine interventions based on the feedback that folks like you provide. So in that vision, we would like to foster partnerships between CBOs, organizations that can come together to um, for prescription for maybe first prescription produce prescription is looks like an organization having the infrastructure and then partnering with a local grower to offer food boxes. We also then will be a support to um, assist with program efficiency, coming together to share best practices and make those standard for programs, um, based on based on nationwide guidance from evaluations that are currently in place from like Limelight. Right now, we have prescription produce interventions that are being evaluated, and uh, results will come from Limelight, and we'll be able to provide best practices. So we want to be able to provide implementing organizations with that information to make sure that they're being as effective as possible. And then offering resource connections, just like meeting at the ININ meeting, networking, coming to the table and having conversations so that we can learn where we can work together. As we continue to think through what we want to accomplish as a network, we're dedicated to supporting you and organizations that are implementing these programs, food as medicine interventions. There are also areas that we identify as priority for the network. Some of these include capacity building, providing support to build capacity within implementing organizations. IDOH will continue to support food equity work for CBOs around the state with grant funding. Um, we are currently seeking to have this done through SNAP-Ed grant programming. We look forward to extending additional rounds of funding to support um, organizations that are making impactful movement in food access and education work that's happening around the state. So that's exciting. For policy, we're looking forward to collaborating with community advocates on policy advocacy efforts for greater impact in the Indiana food system. This could look like partnering with organizations and individuals that can advocate for policy and support some of the food as medicine interventions dealing with Medicaid waivers and other high stakes opportunities. Um, and then networking, again, sharing opportunities and best practices with network members. Here you'll see the 3-pillar model of the network. Also, you'll see my email and contact information there for to reach out. We can share this PDF with you. It's a one-pager that we've been using to kind of describe the network and how it's set up and what we're looking forward to accomplishing here in the future. Um, I won't read the whole thing, but there is information that we've kind of already discussed, but it's just a quick reference guide for the network and that we'd love for you to share with other people, maybe that aren't on the call that would be great to come in and have a opinion, have a say, have some experience that they could share with other people on the call so that we can continue to build the network out. Okay. So shortly, we'll go into the breakout sessions and we'll discuss a lot of these points right here. Um, we have the Double Up Indiana Network pillar. The pillar is obviously going to support Double Up implementers, like the farmers markets and SNAP retailers. Um, we'll convene and share best practices. We'll talk about when is the best time to meet for implementers around the state. We don't want to meet weekly, but we also want to be able to meet enough to discuss challenges and have feedback in timely manners. As we progress through the Double Up transition, our firms, including like farmers markets and market managers, will be able to access the network for technical assistance as the summer winds down and winter begins. There's gonna come things will come up, especially as our transition is happening. So we'll also in the Double Up pillar respond to technical assistance request. In Michelle's presentation, she pretty much went over the Produce RX prescription pillar, but again, we will use the pillar and as a community of practice to come together with other implementers of produce prescription and have discussions between healthcare systems and CBOs that are currently piloting produce prescription programs. There's several on the call now, and we want to continue to support your program and effective evaluation of the programs. As I said, Limelight is currently evaluating initial data and will soon have some results to share with you and other stakeholders. All right. We will also, one thing I would like to mention is that as Michelle created the kind of network map that you saw, we will continue to create visuals for program models for produce prescription and also program models for double up programs as informationals and then also educational resources. The produce prescription pillar will offer assistance in initiating and sustaining partnerships for food sources, for food as medicine interventions. We really want to um, tap into growers and farmers that are available to support these programs in order to stimulate that our local food system. And then finally, with work groups, we would like just in our conversations to have groups of implementers come together and work on the future of produce prescription to discuss how we can elevate the programs that are already happening, what's worked and what hasn't. And our final pillar is the food equity pillar. Um, I know some of you have heard about the food vision that's happening right now, the food vision focus groups that are occurring right now. Some of you haven't, but we'll ask Corey to put the link in the chat for those of you that haven't. Um, but we really want to come together like the food vision is coming together to have conversations around food equity and gather community input. Where are the barriers? What can we do to support? Um, what can we do to support organizations that are working through challenges? And how can we support residents that are working through challenges with food access? And so, yeah, that's the goal of the listening sessions to work with those to work with people that are already working to improve and connect and frame our local food system. We want to know how we can best support you. Um, as you know, our food system, it's vast and it's complex. We are working to hear from, we will be working to hear from each region of our state to ensure that all the voices are heard. In order to, we want to connect with consumers across Indiana, facilitate the listening sessions, and then develop strategies to increase equity. The food pillar will rely on food system workers of all capacities to bring your experiences and knowledge to the table. Our goal will be um, identifying sustainable economic development opportunities. IDOH will work with the community to support programs, provide resources, and secure funding. Um, we hope to establish partnerships all over the state in order to make food access more accessible and reduce those barriers that residents are currently experiencing in food access. All right. We are going to prepare to have our discussions in our pillar, in our group breakouts here. Bear with me while we,
Shalise, I think I have
yes.
everybody assigned.
Do you? That's awesome.
I think so.
Okay.
There was a couple people, but I think we should be able to assign them once we break them out. And then if there's anybody left on the main, we can shoot them over to whatever pillar they're interested in.
Okay. Okay. Great. Let me bring it on here. I see that. Okay. So your managing rooms are, does it give you the option to open the rooms?
I think it does.
Okay.
It's so weird seeing myself.
Sorry.
No, it's
And
okay.
you let me know when you're ready or if you want me to take over. We're
Okay.
just going to have a brief conversation. I think we've timed the rooms for about 15 minutes, just to kind of, Michelle will talk about Produce RX, I'll talk about Double Up, and then we'll reconvene to have that conversation about food equity as a whole.
Okay, yeah. So Becky, do you want to go to produce prescription or double up? I know we have Becky, Gabrielle.
Double up, please.
Double up? Okay. Put you on there. Gabrielle, what about you? And then Jenna Thomas. It looks like Jenna.
Hi, you can put me and Jen are from the same organization, so you could just
Okay.
put each of us in separate ones if that works.
Okay, sure. Does it matter which one?
Nope.
Okay. Let me do that here. And then Shalice, you should just be able to click on the break
Click.
rooms and
Yep.
join the double up one there.
Perfect. Thank you.
And then okay. And then Gabrielle, are you there? I will just sign.
All right. We're gonna, uh, take over. Lindsay, did you have to leave the room?
So I wasn't sure how it worked being in breakout rooms and
Right.
teams. And so I
Right.
clicked leave and it totally ended the call. So I had to go
Oh,
back
okay.
to my calendar invitation and
Okay.
click. Yeah.
I think they're still in the room, but I've got to, if I close the room, then I close it on Michelle. So I'm about to just go over and say,
Oh,
hey, wrap it up. I'll be right back.
interesting.
I know.
Sorry, y'all. I'm the one holding everybody up.
No, that's okay. We had a great discussion. So um, I'm thrilled. I'm thrilled about our conversation in the double up pillar. And we're just going to move right along. All right. I'm going to share my screen, hopefully.
And while you're doing that, Shalise, I'm just going to mention, I'm going to put in the chat, and we'll get this sent out too in the email, but this is just sort of an attendance interest survey. There's 4 questions. If you can just fill it out, and it gives us an idea of which pillar you are interested in receiving information and updates and being a part of the community practices with. So I'm just going to put that in the chat to click on.
All right. I think we have everyone back. So thanks for rejoining. We had great discussion in the double up pillar. And so now I think we've got a little 12 minutes left. We just want to have an open discussion about food equity. I think that to start it off with a broader kind of question was my preference, right? But if there's something else that comes up, another question that someone has, another topic that we need to dig into, I'm totally fine with that. But the question that I've selected today is, what opportunities are we missing as a state to make Indiana's food system more equitable? I think that in our respective positions and roles, we all have an opinion about what can be done, where we're seeing gaps. Um, I would love to hear from you, the people that are in the in the field, in the trenches. I am there with you. I think I told my group, the double up pillar group, that um, in addition to being the nutrition incentive manager, I have managed the Indy Winter Farmers Market for the last 3 years. And so I am also a market manager. I implement SNAP and Double Up and Fresh Bucks like every weekend. And so um, I see the gaps. And so I want to know from other people what you're seeing and where you think we can step up to support. Um, if they and we will, the floor is open, so anyone that wants to unmute and have that conversation can. And I probably will stop. I'm not going to stop sharing, but I need to figure out how to see everyone. Does anyone have anything to add right now?
Can you share those thoughts, the gaps you feel like are missing?
Yeah. Michelle, I'm sorry that you see yourself right here. I'm maybe okay. Let me do that. And it's still. I don't know. Okay, I'll. What are you seeing on the screen? Can you tell me
I
on
just
my
see
screen?
everybody. Yep,
You
I
see
just see it.
everyone?
Yeah, I think we're good
Okay.
with this,
Okay.
Shalice.
Great. Okay.
Yep.
So I, I'm going to start with what it has been on my mind just for the last 2 days. Someone shared on LinkedIn a conversation with a group of youth from the east side of Indianapolis. And this group of youth were talking about food access and um, making healthy choices. And the question was posed, what why can't you get healthy food? And some of the answers from the kids were basically, well, there's no grocery store that sells healthy food in my neighborhood. Um, Another answer was, I rather eat the unhealthy food because that's what I'm used to. One answer was, how am I supposed to get to the food if my mom's car is broke down? And another response was, well, I know that there's an option for healthy foods, and I tried to get on SNAP as a college student, but I was denied, and the SNAP application is just so complicated that I think people are discouraged. And all of those barriers have been on my mind since I saw that conversation. Um, and the one that stuck out with me was a doctor said, well, there's FreshBooks. None of those people had heard of FreshBooks. And that's now my role to make sure that FreshBooks is in front of all residents, right? All the residents of the state. So I think that we're missing opportunities for connection with people that are experiencing about these barriers. Um, and so for the last several days, I've been trying to figure out how can I get to those people without physically going to those people. Um, that's the question. I don't have an answer right now, but it's been on my mind for the last couple days. So
That's been my experience when you ask about gaps. Last year we got a small grant with the Double Up program for marketing specifically, and we were able to use some funds to really market that Double Up program. But this year we weren't. And while we're still seeing people use their Double Up, we're only able to utilize social media as a free way to let people know we utilize the program. So I feel like that is a big gap for all of us, is being able to advertise on a larger scale um, to people in our community.
mhm, I agree. I agree. Does anyone else have anything to share? Thoughts?
I always have things to share. So, yeah, I mean, I would echo that. I think that like as a new, I guess, resident of Indiana, I think my team questions why we don't have a better direct connection with our SNAP office and like why Double Up is not like a direct program that's referred when you're identified as a SNAP recipient in that area, like why there's not a direct connection to places you can better leverage your SNAP benefits. That seems to be the easiest way than to try to get them on the backside. And then I think to me, equity is always going to mean also options. And I think even with like FMNP and like moving to the virtual voucher, I know for many reasons why that's better. I mean, it's just kind of, once again, it's one of those things where it's not accessible for certain people to have things only on their phone. Or for farmers, certain types of farmers to run those on their phone. And so I'm not saying like don't do digital options, but it's just to me, options are just going to be needed because there are a lot of people that do not like technology that are benefit recipients. So, yeah, I mean, I agree with just missing opportunities for connection. We have started to promote SNAP, I think, or Double Up and SNAP acceptance at farmers markets in places that just like what you wouldn't normally talk about them. And that has been actually super crucial, I feel like, to the growth of our program, because I just think you never know who you're talking to and you never know who they know and can refer to. So we've even been doing like night markets that are a little bit more social, or like art, just different things that are just more social events, where they're not typically talking about those things. But yeah, it's been interesting to try to reach SNAP. I mean, we know that we're only reaching such a small fraction of people who exceed SNAP benefits. And you can see it when someone finally gets what this program can offer. You can see them come back. So it's not like a usage problem. It's just, yeah, I think it's just primarily a mass communication problem. So
I love that. Can I just mention something real fast? And I only have a few minutes. Maria, GusNIP or no GusNIP, our whole goal too is to build out a communication campaign and having that connection with FSSA. Unfortunately, sometimes it comes down to people in positions. I don't even think there's an administrator right now for FSSA, to tell you the truth. But I'm so glad that you brought that up. I think it's important for everybody to hear that there is a misconnect there in our state around that, and that we will be doing our best to really make a connection there. And we're going to have to, especially even on the technology component of it too. So thank you for sharing that.
Yeah, thank you. Awesome. I didn't check the chat. Do you know if Corey, Michelle shared the Food Vision link?
She did.
She did? Okay.
She did. Yep. And Shalise, I only made a comment on one of the gaps that I think, I know we always talk about transportation, but you think of basic needs, and sometimes you see like certain funding streams allowing this but not allowing that. But it's like, if you don't allow like transportation in your funding, but you can allow food, or if you don't allow food, I don't know. I just feel like there needs to be more discretionary funding that allows all social determinant, like all drivers of social determinants. And so I think as we think about the mini grants that we will be submitting out, making sure we're clear about, connecting all of those dots too. I mean, that's what I think of when I think of equity, food, health, all the above.
Absolutely. Absolutely. Awesome. I want to share I can't get it. I want to share our contact information, Michelle, we have 1 minute, so I'm gonna to do that here.
I could put it in the chat if people want to cut and paste too. Yeah.
Okay. This is our contact information. The last few things I want to say is Corey put in the Food Vision link. That link will expire in about a month. So if you haven't heard about it, you can go to that website and learn more about that. It's the DMPA is just gathering information about people that consume food in the state and will help as we plan for the future of food in Indiana. And so it's about a 10-minute survey. If you could take that, share it with your network, that'd be great if you haven't already done that. I thank you so much for your time today. I will send out an email with the slides so that you have that and review of this conversation and our double up pillar. You'll hear from me also. Thank you again for your time and feel free to contact myself or Michelle. Have a great afternoon. Thank you.
Thanks, everybody.